We're warming up the left hand in preparation for doing ConnecTX therapy on a contracture, most likely a Dupuytren contracture on the affecting the index finger of the left hand, limiting full flexion. Progress so far would be that it's easier for the hand to close and the range of motion is greater. Do you want to describe what it was like in the beginning and perhaps where you feel like you're at now?
When it started out, the most I could close my hand, the finger was about 50%, and now I can make a full fist. So, I mean, this has been over the span of working with Dr. Mullen, probably I would say, well, 3 weeks maybe.
Mm-hmm.
And this situation, injury if you want to call it, had started about the middle of March. I had gone to a orthopedic hand doctor, surgeon, physician, and gave 2 options, which was either surgery or injecting it with cortisone. And so since that time, that was about mid to the end of June, but there was nothing was done. And then I came to see Dr. Mullen for something else, and we also, once that was fixed, cured, helped, we decided to focus on the hands. So
that was your low back and your leg you're referring to?
Yes, the nerve pain for the lower back and leg, and which has completely dissipated. But as far as this, this has been marked improvement since middle of March.
Okay, well, thank you. Zeth, do you feel the heat from that? Perfect. Okay. I'm just painting the area, just covering it with the emollient. This is the specific area where the contracture is, right here. We're going to be covering the forearm flexors and the extensors as well, so we'll make sure we get emollient over that area. Okay. If anything is a 5 out of 5 in terms of discomfort, you let me know.
Okay. Well,
5 would be that that hurts, please
right.
stop.
Well, you do feel it, but
Covering around the contracture. We'll slacken a little bit. Might be hard for the camera to see, but we'll try and get underneath it a little bit as well. Just turn the forearm out a little, just a little bit. And I'm adding some passive movement in as well, going from flexion to extension. So go ahead and open the hand up. Okay. Get along the sides of the tendons and the digit. Okay, now just start to close the hand. And now slowly start to open it up. And again, close. And go ahead and open it up all the way. Stretch it, and extend the wrist as well. Okay, good. And close it up. Now go ahead and open it up. And close, and go ahead and open. And now relax it. Good. You okay?
Yep.
All right?
Well, you do get my attention.
Good. Go ahead and make some fists. And close it down. Okay, that's pretty nice range.
Mm-hmm.
What's it like in the morning when you first open it?
Probably about, at the most, probably about that.
Okay, good. Very good. Make sure I get some cross friction in here as well. Feel that crunch?
Mm-hmm.
Not the
Yep.
mic can pick that up, but definitely making some noise. A very flat angle as I'm passing over that. And I'm going to come in the other direction as well and mix up some angles in there. Okay, good. So we're also going to treat the forearm flexors with this, right? So let's bend the wrist, right? And bend the finger and bend the elbow. When I tell you to, just kind of open it up and extend it like that. Okay? Mm-hmm. So go ahead, bend, and now slowly start to open up. Go ahead, keep going. Extend the elbow all the way at the end as well. Very good. Let's try that again. Actually, let's try grabbing this. Grab the instrument.
Okay.
Now flex the wrist and flex the elbow. So you're going to press into this as I press down. Now slowly start to extend the wrist and then unfold the fingers and then extend the elbow. You okay?
Yep.
Okay. We're going to do that again, but this time we're going to just hold it up there. Keep those fingers tight until I tell you to release, okay? Keep the wrist flexed, all right? And the first thing I want you to do is to just unfold the fingers. Just lighten up the fingers, but keep the wrist flexed. And now start to unfold them now. And then keep going all the way open, extend the elbow as well. Keep going, just extend everything. You okay?
Yep.
Okay. Okay, just do some passive movement there as well. Okay. We're also going to treat the extensor surface. This is a lot more sinewy. It's not as much meat on the back of it, but that's where you feel some of that tightness, right? You feel it in the back of the hand,
Yeah.
correct? Okay, good. Going to get in between, trying to get on the sides of those tendon sheaths. When you're on bony surfaces, it's kind of like it's like going over a speed bump in a car. You want to slow down and take it easy.
Well, especially up near the tip.
Yes, yeah.
I can feel that a lot.
And I'm going to have you just kind of extend, and I'll go ahead and flex. Just wrap around my hand. There you go, just like that. Okay, so go ahead, open, and go ahead and flex. And again, and go ahead and flex. And again, one more time, and go ahead. Okay, relax. Just hold on to that. Hold on. Like you're shaking my hand. Yeah, okay. Just squeeze it.
My brother.
You got it. Okay, so go ahead and now let go and just extend it like that. Mm-hmm. And when I tell you to, you're going to bend and fold it all up like
Okay.
that. And then flex the wrist as well.
Okay.
Okay? Start with a little elbow extension as well, flexion as well.
Okay.
Okay, so go ahead. And just keep going, keep going, keep going, keep going. And again, extend it all, extend it all. And go ahead. And we'll do one more pass. Come up. And I'm going to just hold it up there. Hold it up there. Press, 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 press. Okay, start to flex. Okay, good. Relax. Feel that crack?
Yep. I can,
A little manipulation at the end. Okay, let's see you bend it all the way. Beautiful. All right, it's a good note to end on.